Now that we have explained about the importance of 0 to 3 sensory nurture, let us talk about the multisensory integration SCI-Educare universal nurture curriculum. From the time the baby is born, they are rapidly wiring and it is a dynamic brain growth, and for hearing, seeing, sensory perception with the emotional bonding, self trust and worth. To inculcate all these, we cannot reason with them. We need to create a pathways from outside to inside, and this is like a broadband that we are creating from sight, sound, taste, touch and smell to form a neuroanatomy, and this anatomy becomes a functional unit. In other words, this brain structure has to function. If the structure gets damaged, the function gets disarmed, and there will be disturbances in developmental skills. So, to obtain optimal nurture, every moment is important while the child is awake. So, SCI Institute of Educare, Dr. Meena Chintapalli developed and patented this curriculum, which is tummy times 3 minutes down and supine position 3 minutes 6 times a day. And what do we accomplish while we are doing this? With the tummy time, music is played, classical soothing music, not real loud noises. It could be any soft music that goes into the right ear from 2 o'clock position, while the mother takes her bare hands and touches with the hands the bare skin, goes from buttocks up towards the shoulders with the fanning movements that are going outwards towards the shoulders, and stroking movements from top down towards the shoulders, and bicycling exercises. What are we giving by doing this? When the right ear is hearing and the infant stops all the activities or kicking of the legs and tries to get up, stow chest up and shift the eyes, that infant is listening. We are connecting listening capabilities from the right ear, 250,000 cells per minute, connecting to the left prefrontal cortex, and the messages are being formed, and these are 250,000 times 10,000 connections for listening and spatial reasoning and identifying the direction where the sound is coming from. Multisensory integration shows that the theory, the principle shows if 2 or 3 stimuli are presented, one sensory perception becomes stronger. So, this auditory perception is visually tracked, and ultimately both the auditory and the visual perception becomes stronger. But every information is accepted in a state of relaxation. If there is fear, threat, lack of relaxation, there will not be sensory perception or integration. Therefore, the mother's touch is the best that causes emotional bonding and relaxation. At the same time, when there are bicycling exercises in the prone position, what is happening is we are releasing endorphins, lactates and pyruvates that also relax the blood vessels as well as the body tone. When we flip the infant to the supine position and keep playing the music from 2 o'clock position, 250,000 cells per minute times 10,000 are transmitting impulses for hearing from the other ear, which is the left ear, to the right prefrontal cortex. We are already crossing the fibers for hearing within the corpus callosum, and at the same time the bicycling exercises and the touch therapy along with the classical music draws the attention for spatial reasoning, and this time there will be more visual tracking as the infant looks at the primary caretaker briefly and becomes sustained by the 3rd week, and as the mother is, which is hi baby, how are you baby, are you soothing baby, kind of a communication gives an input for emotional linguistic abilities. We have to remember from the time of birth through the first 5 months, an infant should be exposed to the native language that the parents want the child to learn. But if they want 5 languages to be learned, only one person speaks one language, the other person speaks the other language, otherwise the information gets scattered and they cannot learn any language. So, we are giving multisensory integration just by doing this much deed from 2 o'clock position. If we play the same music all day, because Dr. Chintapalli is advising music is good for overall development and linguistic abilities, what happens is the infant will tune out, because they already heard the sound, they stop listening to the sound, they tune out. When they tune out, we are losing 600,000 cells per minute. So, the only other time to bring reasoning and discrimination for spatial reasoning, I move the sound to a diagonally opposite position, which is at 8 o'clock position next time around, prone 3 minutes, same sequential stimulus is given, the touch therapy, the exercises and the music, and in the supine position the same eye contact, touch therapy going from bottom up in a fanning movement, arms stretched inside and outside, up and down, and bicycling exercises for the endorphin release and relaxation responses. If the same music is played once again, the infant will not tune in. The tuning out is much more common if the same music used again and again. Therefore, the music needs to be changed for the same sequela of synchrony and temporal sequencing of events with the sound, touch, eye, visual contact, or the exercises or kinesthetics. From 3 o'clock position same music, and 9 o'clock position same music, 4 o'clock, 10 o'clock another music. What all we are spending is only a quality time, 6 minutes each time, 6 times a day, 36 minutes does wonders. The downtime is much more important, and infants do cry when they are praise prone, because they do not have a stimulus, they feel insecure. If a colorful object is placed in front of them, or a movement is placed with a light and dark colored ball or a toy, that can distract them. So, this is sensory nurture based upon the multisensory integration principles of Bayesian principles. If the infant is not getting this privilege, what are all the conditions where infant tunes out? If there is no feeling of love through the eye contact, no visual tracking, infant easily tunes out. And these pathways are important for reading skills, because we are actually creating broad bands from outside to inside. Broader the band, faster is the transmission. And if the infant is hearing loud noises, they do not know how to close their ears and run away, so they tune out. They are killing 600,000 cells per minute. If the parent is there but is not touching, the soothing and comforting and self-trusting pathways are also lost. Therefore, rather than electronics, an emotional bonding, emotional trust, reciprocity, and eye contact with emotion of love, sympathy and empathy to nurture the natural state of every newborn who has love, sympathy, empathy and willingness to learn should be offered. If out of love, lot of parents who are elderly, grandparents taking care of the children, or both mom and dad are awful busy, they come home, they have to get the dinner ready and they stick the child in front of a television or cartoons, that overstimulates the brain. Now, we do know that autism spectrum disorder has heavy volumes of the brain and bizarre nerve connections. Whether this has any role in it, research will tell us in the future, but I did have personal experience over the last 26 years that if there was a language delay, or when there is an eye contact that is not offered, or if the child is not stopping and listening to tunes and resume the activity, I stopped the electronics totally, and I made the parent as the teacher and the therapist who had offered all these therapies, and the children started integrating the senses. This is an important aspect, and I will give you case studies where the violence, domestic violence, neglect, maternal depression, which has a major role in sensory segregation. I will give 3 or 4 examples today. I have treated hundreds of kids who had similar problems, and the sensory nurture and curriculum worked from NICU, neonatal intensive care unit graduates who had autism spectrum disorder to autism spectrum disorder in violence and anxiety neurosis and attachment disorders at the same time. For example, what can love do to a child? A couple brought a 3.5-year-old to me who was not making eye contact, who is hyper, who is jumping all around, and the history is that mother and father are busy workers and they worked until 6 o'clock in the evening. Grandparents were watching this child, and he was a precious child after 9 years of marriage, and grandmother would put him in front of television 3 to 4 hours as she had work to do. When parents came back home, he was an ordeal where he was constantly moving. The only way he calmed down is with electronics, cartoons, iPad, not any hands-on games or physical activities. So, they loved him too much. When he screamed, they gave him everything. If he wanted chocolate, he had it. If he wanted chocolate milk at 12 midnight, he had it, because they loved him to death. I heard this history. I did explain to them about the sensory nurture, missed opportunities, brain is malleable and plastic, and how we need to set limits on the behavior, how we need to integrate senses through music, touch therapy, chin lift, hands-on activity, and total avoidance until he is talking of electronic gadgets. It was a challenge for them in the first 6 months, but at the end of the 6 months, with all the other therapies also, with minus the ABA therapy, he started talking, he started making eye contact, he started expressing himself. The only thing he ultimately had was speech therapy. He speaks very clearly. He is a senior at high school. The one thing that we still deal with him is his ADHD. And he was well under my control, and after I sold my practice, he was being followed by another provider in the same practice who did not emphasize on electronics and electronic gaming being detrimental to the child. He went into a severe anger management issues and got suspended one time, and he realizes that now he is back with his cognitive behavior modification with positive thinking, physical activities, martial arts, music, and tutoring, and he is making good grades and strides. He is going to go to college. Another 3.5-year-old who came to me, not 3.5, 32 months of age, an 18-year-old mother brought the child who was in a daze, who wasn't making any eye contact, who was running all over the place, underneath the sink, underneath the table, and was diagnosed autism, who is going to have an animal behavior all his life. When I took the history, this mother was 16 when she was a teen mom who was very, very insecure, and she and her boyfriend had a joint custody, and this child was left in the care of the father. One time the police went and picked him up from a closet while he was having a girlfriend in his hands, and then she also lived with a sister whose husband was an authoritarian who had loud voice and would spank and scream to freeze the children. After I explained about the brain networks, and she took a medical assistance course, and she nurtured him through music, speech therapy, occupational therapy, and PPCD through the school, in addition to mommy therapy that I provided. The child started talking in 6 months. The only morbidity we had was the ADHD behavior, but he was expressive, he made eye contact, he is in the mainstream at school, and he is a winner, and it was never written in stone. And the third case I could tell you, I had an executive father who is a banker and a mother who is a registered nurse. Her son at 32 months was not talking, and they loved their children. They had a normal life, they had affluent class, they had everything that they could offer. The 4-year-old was acting up. After I explained what causes child trauma, anxiety, stress, and how the inhibitory pathways take place, and how the electronics are overstimulating and also can inhibit linguistic abilities, mother did follow the curriculum, the nurture, the chin lift, physical hands-on activities minus the electronics. But another factor that she expressed with me after I talked about the domestic violence and the family dysfunction, she was a depressed mother with both the children. As her husband had alcohol problem, they would have squabbles. She thought the children were not hearing, and the 4-year-old boy heard and the younger boy withdrew. Therefore, between these inhibitory and excitatory systems, the balance was lost in both the children. And once they developed skills in the sensory nurture curriculum of touch therapy, hands-on activities, phonemic presentation, floor time, face time with the parent as the main teacher, the child started talking within 3 to 4 months, is in the main classroom. His neurologist, who claimed him to be having an animal behavior all his lifetime, called it as a miracle. Therefore, brain is plastic, malleable. Although we lose opportunities 0 to 3 years, we can offer help, but the sooner the better, we will have a better society. Thank you for listening.